It is time for our Morning Line program here at this time, as we have Monday through Friday. And today we're joined in with Chuck Nordyke, who was recently named the new CEO at Clarinda Regional Health Center. And Chuck, it's great to have you with us. How's it going this morning?
It's going well. Thank you, Brent.
Well, again, thanks a lot for taking the time to be with us today, Chuck. And, as we get started, first, can you just fill us in on your background? Tell us about yourself and your previous work in healthcare.
Sure. Been in healthcare for almost 30 years now. I've been a nurse for about 25, 26. I've worked in and out of nursing roles in the short-term acute care, so the traditional hospitals, as well as the post-acute care. I had a consulting business for a while, ran that for several years, and then sold that with some software that I developed. Came back into healthcare, the hospital side again. Started working in the post-acute as a COO and a CEO of a long-term acute care facility out in Savannah, Georgia, and then moved to Pittsburgh with the same company, and then got recruited over to the company I'm currently with back into Northwest Indiana. So I've been in and out of the Midwest majority of my life, and in different leadership roles, whether it's a building CEO or divisional president overseeing several buildings throughout the Midwest.
Yeah, and along the way there, what were maybe some of the accomplishments you've had in your career?
I think my biggest accomplishment was figuring out the driving force for healthcare. I mean, healthcare is a very personal thing, and the driving force behind everything we should be doing is quality. And once we focus in on that and make sure that that's first and foremost, the rest of the stuff kind of falls in line. So I think figuring that out early has been a huge accomplishment for me. But I've been fortunate. I've had great teams, been able to develop really good groups to work with. We've had great building turnarounds in many different markets. Our employee satisfaction and patient satisfaction scores are through the roof in most of these buildings, and I think that's probably what I'm most proud of.
Well, how did you come about this Clarinda position, and what led you to pursue the spot?
I've made a lot of connections in healthcare through the years, and some folks were talking to me about Bryan Health and what a great company and organization it is to work with, and I've been kind of keeping an eye on them, and I happened to hear about Clarinda and the position that was open and started to look into it a little bit. Again, love the Midwest and excited about the opportunity to experience a different part of the Midwest that I haven't really experienced in the past, but came through it just by word of mouth and started talking with Bryan Health, and here we are today.
Well, we're really excited for you as you take on the new role. What's next in the process here, Chuck, especially this transition process for you and your family?
Yeah, well, we're going to find a home, which we've narrowed them down quite a bit, so we're getting close to that, and set up the move and get everything going and get out there as soon as we can.
Well, let's talk about the job itself as CEO there at CRHC. What are some of your initial goals upon arrival?
I think the first thing I'm going to do, and I heard this loud and clear when I was with talking with the team out there, I'm going to listen and I'm going to watch what they're doing and see what's working well and what's not working well, and come up with some solutions for the short term and long term. And then also listen to the community. When I came into town, I stopped off at a couple places and talked to some folks, and everyone was very welcoming and receptive to me being, an outsider at that point. They didn't know who I was. Started talking about the hospital and just healthcare in general, and they gave me some ideas. So I think it's important to listen to all facets of the internal team and the external team.
Well, and I know you're just getting settled in, but maybe talk about what you're hoping to accomplish in Clarinda. Can we talk long-term a little bit here?
Sure. I think that, one of the things in healthcare that we have to do is make sure that we're providing the proper programs, which I think Clarinda's got a lot of programs in place already. That's part of listening to everything and seeing what's already there and what needs to be developed. So get that going so that we can grow volume and visits, and then improve the financials and make sure that the hospital is viable long term, and then we can continue to provide good quality care down the road.
Well, I know one thing that CRHC has always pushed is that reputation of quality health care for the area. How would you look to help ensure that role as you move forward?
I agree. I think I've looked at the quality numbers, and they do look good. I think that we can work on improving those and continuing to provide that quality care. I think that healthcare is a very personal thing. I think everyone's been impacted by healthcare in some form of their life, and we have to drive it as quality. Quality's first. Quality's measurable. Quality is something that everyone can look at and say, that's why I go here. And I think that's what we need to make sure that we are delivering on all assets.
One final question here, Chuck. Just in your short time as being named CEO, what have you learned about Clarinda Regional Health Center?
Well, I've learned a couple things. I've learned that I've learned a lot about the history of healthcare in Clarinda and how the new hospital came to be. I've learned about a lot of the programs that Clarinda has to offer. So I'm kind of working through the transition, trying to get everything so I can get out there, but I'm still trying to learn as much as I can so when I'm there I can hit the ground running.
Well, thanks a lot for being with us today, Chuck. We really are happy for you as you got that new role there as CEO, and we look forward to working with you down the line. Have a good one, all right?
You too, and thank you, Brent.
Absolutely. That's Chuck Nordyke, the new CEO at Clarinda Regional Health Center.